Okay, and welcome to all the people online joining us. So I hope you all enjoyed the keynotes. It's my pleasure now to introduce the showcase presenters. So first up, if I could invite Charlotte Crowl up to the stage. So Charlotte is a Mental Health for All Fellow. And the way that this is going to run today is we'll have 7 speakers of 5 minutes each. If you could hold your questions, and then we'll get everybody up on the stage to do a Q&A at the end. Okay, so over to you, Charlotte.
Thanks. Hi, everyone. So my name's Charlotte and feeling a little bit nervous, but yeah. So my background is I had cancer when I was 17, and then through my treatment, I experienced steroid-induced psychosis as well as a brain injury. So I've done a lot of speaking engagements and I wrote a book. I work in peer support, a cancer charity where I support women of color who have gone through cancer. And I've been like a co-investigator on a few projects looking at mental health and cancer. So my journey has been very, not straightforward to get into research. I don't really have much of an academic background. I never got a degree because of what I went through when I was 17. So I done a quote here for NIHR, which says, "My journey into research wasn't linear or planned. It was lived and life experience. Life prepared me by personal experience, community work, and commitment to inclusion." And when we embrace these varied pathways, we create space for research that truly sees, hears, and serves the diverse communities it aims to impact. Not all researchers arrive by academia. Some arrive by surviving, which is just as vital as data. So I done a quote, which is, "If we can't be seen, how can we be heard?" And I want you to remember that when I get to the last slide. So as a NIHR fellow, I'm not actually a researcher as such, but I'm learning how to research. And my question at the moment is about exploring the impact of culturally centered peer support on mental health of Black individuals who have experienced a cancer diagnosis. So the reason that I think that this is important is because we've seen how well the peer support model is working right now in NHS for mental health. I myself am a peer support worker in the cancer industry. I'd love to see it rolled out at the same kind of capacity. Right now, they literally just launched the 10-year cancer plan, which I was speaking to Wedge about a couple of months ago, where they're basically looking at causing better impact, more numbers, and I guess dealing with the health inequalities that we really do face in the healthcare system. So as a Black woman who's gone through cancer and worked with a lot of women who have gone through, we see a lot of health inequalities. So I done some quotes here, which is from my charity. And when we did a survey, we found that 46% wasn't offered therapy after treatment. 81% struggled with mental health after treatment. And 87% suffer with long-term side effects. And that in itself can affect your mental health. So you're just looking at ways where we can help, in better ways. I feel like I'm rambling a bit, but okay. Right. So the vision ahead is to embed peer support into cancer services, have more culturally safe spaces to promote healing and equity, community-led solutions, as we can't wait for system reform, which we know takes a long time, but also I know research takes a long time. It can take like 20 years from you doing a piece of research for it to actually then be rolled out. And I hope that the NIHR fellowship helps me turn this insight into action. So if you remember the quote at the beginning, which I can't actually remember, but it was, and it's like, if we can't be seen, how can we be heard? Well, my quote at the end is, change can start with feeling seen and heard. And I feel like that is actually applicable to all areas of life. And that's me. That's my.
Thank you so much, Charlotte, for your talk. Wonderful. So people who've got questions for Charlotte, if you could hold those until the end. Thank you so much. Okay, so next up we have Dr. Claudio Di Lorito, who is an ARC North Thames Research Fellow. So Claudio, can I welcome you to the stage?
Thank you very much. Thanks for having me. So today I'm going to be talking quite briefly about practical example of how to build impactful research pathway for underserved communities, and an example of how we did it through co-design methods. So hopefully some of the things I'll talk about will second and echo the previous presentations. So I'll go through steps and I'll show you what we've done. The first thing that we did was we identified issues and priorities. So this particular research project was around LGBTQ+ communities living with dementia. And we know that this community is highly underserved throughout the dementia pathway for several reasons. So the priority for us was to engage with the community in research and co-design together some outputs that could address some of the unmet needs of people from the community. The second step was we set up the project by creating our team of experts by experience, so people from the community living with dementia, caregivers and families of choice as well, experts by training, which means researchers and academics who've done stuff in the field, and also experts by practice, so practitioners. We put together a group. We also sought partnership from Dementia UK, which supported us, and we submitted a request for grant through the UCL Grant Challenges funding, addressing inequalities in health. We were successful, and we ran a project which had 3 core elements, and which was underlined by principles of co-design methods. So I'll talk you through the steps of the project just to illustrate them. The first one we're really quite proud of was storyboards. So storyboards are essentially co-designed illustrations of dementia journeys, directly created from people from the community. We started off by asking people in the community the question, what is your story? It was a very broad question. Together with them, we gathered narratives. We drafted iterations of the storyboards. So we started with initial drafts. We co-created them with an artist, a visual artist. And with the partners, we then refined them until we had a final version that fully reflected the person experience. That's just an example. We created 6 of them from different members of the community. We also held a couple of workshops. So the issues that emerged in these storyboards were the platform upon which we held these workshops, in which we invited people from the community, supporters and allies, people working in different sectors, including voluntary, NHS, people from councils, and researchers as well. We discussed together research priorities. So what are some of the important issues that we need to address in research? And we operationalized these into a research proposal. And finally, we had an impact and dissemination event where we showcased all the storyboards, the research priority, and it was really just an opportunity for networking and celebrating the work that we did together. Finally, some pointers that we've learned by doing things. For us, it was important to identify suitable funding, so knowing what the funders wanted in terms of their remit and ethos. We also think there's no need to for large funding to do things that are meaningful. It's okay to start small and being ambitious and then grow bigger. At the same time, it's important not to be over-ambitious. We'd prefer to keep it quite meaningful and local as opposed to broad and dispersed resources, really. It's important to design your project to be an equal partnership from day one, as the previous speakers much better said. It's important to involve people with lived experience as co-ops in the project, but also, of course, co-ops that have done previous extensive work in the area. Of course, engage with your community organizations. We couldn't have done it without. So don't be shy. Go in the community, talk to people. Don't just email them. Get really that trust thing going. Use methodologies that are established and find innovative ways to disseminate outputs, really something that echoes with the community, just like the storyboards, for example. And it's important to also create long-lasting collaborations and legacy. So just go beyond your project. So that's me. I think we're good with timing. Thank you for your attention.
Wonderful. Thank you so much, Claudio. Fabulous. Okay, so next up to the stage, we have Sandev Panaser, who is also a Mental Health for All Fellow.
Great, thank you very much. Hi, everyone. So I am Sandev. I am also on the same fellowship scheme as Charlotte. So what we do, we are training to be researchers, but we kind of do things outside of this as well, which kind of gear us to have that pathway to be able to kind of work with people in the community, but also bring that into a research lens. So my role outside of this is peer support lead for universities. So I set up peer support schemes and peer support services across universities in Birmingham. So I think kind of the way I've put this presentation together is to explore a little bit around why lived experience matters and why we should use and bring lived experience into research. So what I'm looking at the moment is how do people with lived experience practitioners, peer support workers, support students who take a leave of absence or a break from their studies as a result of mental health conditions or conditions exacerbated by a neurodiversity. So actually, when students go on a leave of absence, they can't access university mental health services because they're no longer paying their fees. So odds are they come to the NHS anyway or access their sector organisations or none of them at all. So part of the research that I want to do and kind of I'm using this year to train for is to work with people who have lived experience, because that in itself is data, but not researching at them, researching alongside them. So bringing them on that journey with me. And lived experience is leadership in itself, because it brings a whole new perspective of what we assume that people might think to actually what they actually may be experiencing that I would never have known because I've never been through it before. So here are a couple of quotes from students who have been through that service. So somebody said when they went on their leave of absence that I left to find myself, not to lose my future. And if it wasn't for you showing me that there is a future, I wouldn't have come back and finished my degree. So actually, a lived experience practitioner shows somebody that there is hope for the future. And actually, that's really powerful when we're trying to capture that voice. So in terms of creative approaches, I think I've kind of gone into this part of the presentation to look at how do we get to that emotional truth. And I always am a huge advocate for creativity. So Pause, which is an up to 25 mental health service, which is a drop-in service in Birmingham. I set one of those up at the University of Birmingham a few years ago. And the way in which we engaged people and went through the evaluation process was in very creative ways. So the pictures that you've got on the screen, you've got craft activities on this kind of long picture here. We had stone painting and we had like badminton and other sports activities. And what we did whilst we kind of engaged people in those, we asked them questions, we talked to them, we asked them, you know, what sort of things have you been experiencing? And actually that was data rich, but not having to sit in a room as you would in a clinical environment and say, you know, what's your goals-based outcome? And, you know, are you a 5 today, you're a 6 today? Actually, what is that real lived experience? So that kind of brings me on to, ethical safety versus emotional safety. And I think the ethics bit of research is around kind of those things around like informed consent, right to withdraw, protection from harm. But actually, how do we create an emotionally safe environment for someone to actually talk about things? So is that, being able to create a safer space rather than a safe space? Because who are we to define? How do we do that? What do we, listen to these people for, and how do we bring those experiences in? So actually, in terms of dissemination, it's not all about research papers. It's actually about, can you do a TikTok video? Can you do, a short video? Can you do like art exhibitions? Can you do workshops, community events? So some of those lessons that I've learned is around trust building, and actually not doing it in an artificial way, but actually feeling as though you have that partnership with a purpose. So be that people person, relate to the people that you're, kind of working with, and just find common ground, and bring that story out. And it's that storytelling which supports systemic change, whether it's the NHS, whether it's, in your charities, wherever. And the accessible language, is it culturally appropriate? Is it appropriate for that time period? Who are we speaking with? Listen to the people that we are kind of collecting that data alongside. I'm sorry, that's me.
Thank you so much, Sandev. That was wonderful. Great to hear about storytelling, and particularly in clean on that. Lovely. Okay, so next we have Zach Howarth. And Zach has a background in lived experience, patient and public involvement work, and is currently a fellow on the Mental Health for All programme. So Zach, would you like to come up?
Right. I'm Zach. I'm a public and patient consultant and part of the MHR2 fellowship program. I've been involved in designer research for about 13 years now. And ultimately, I want to use my fellowship to improve it for all involved. So I'm going to conduct a scope and review of qualitative research, looking at experiences, of people involved in co-producing mental health research with a view to design an interview study. But I'm going to use this 5 minutes to share some initial reflections on PPI. So the ethos of PPI, our public and patient involvement, is nothing about us without us. This is the idea that no policy should be decided without participation of those affected. So does this mean PPI is just working alongside patients and letting them help out? But framing it in this way leads to a tendency for it to be done in ways that are easy to measure, creating a culture of tokenism that might not consider the impact we can have on research. Most of the literature focuses on guiding researchers, setting up groups, talks a lot about advantages like increasing recruitment, improving materials, bringing fresh perspective and adding clarity, but there's not much guiding public consultants. PPI should be about patients generating and guiding research. Often in research, the questions are generated prior to our involvement, so maybe patient groups could be set up to generate the questions. It's also not always efficient. Lots of time and resources can be spent on it, but if it doesn't benefit service users or have an impact on the research, you could argue the time and resources are wasted. Things like the use of jargon or acronyms can make our contributions difficult and stop those involved fully understanding the project, and so our feedback could be misinformed. Researchers could hold training sessions, but this requires time and funding, which might not have been factored in. So in future, it might be an idea to have training for public consultants in an RA dedicated to PPI costed in from the start. But it's more than an addition to research. It's a reciprocal learning exercise and a moral imperative. The patient is not just a means to an end. The benefits of recruitment are a good example of PPI as a means to an end. This isn't necessarily bad, but these considerations are secondary when you consider it first and foremost a patient right. It represents an institutional change where patients are listened to and not just dictated to, developing a conversation between researchers and patients and presenting a blueprint for a more democratic model of healthcare and research. We're all learning together, all for different reasons and in different capacities, but to the same end. It's an environment conducive to change, where stakeholders can influence research and service development. Because often in society, our voices are lost or dismissed, with healthcare decisions being made from the top down in a fashion very detached from the patient, and sometimes even the clinician. Patients need to be empowered through representation in research, and interventions developed on their behalf. Our consultations bring insight as we bridge the gap between research and real life. Often trainees tell us they find it difficult to go from academic writing to a more standard style that anyone can understand, and talking with us helps. They enjoy the fresh perspectives we bring, and the phrase "I hadn't thought about" pops up a lot in these chats. When you break public and patient involvement down, it encompasses many roles. With lay summaries and materials, we take on an editing role. During role plays, we're method actors. When talking through projects with research, we're sounding boards. And when we discuss mental health more generally, we're a focus group. As well as the benefits to research, often the experience of talking about mental health in this way is cathartic. We should be part of the research team with a specific role to play, and not just an add-on. But because all funders require evidence of PPI, it can become a tick box exercise, which is why research looking to increase and improve public and patient involvement is needed, like a lot of the chats today. So we're all in this life together. So let's build collaborative community networks, develop accessible supportive services, and help one another through this chaotic period of history. And PPI is a good place to start. Thank you.
Thanks so much, Zach, for that really inspiring talk. I really liked your phrase that we're all learning together. Yeah, I thought that was wonderful. Fabulous. Okay, all right. So moving on to our fifth speaker. So we're welcoming Pooja Schmill, and Pooja is from King's College London.
Thank you, and hello, everyone. I'm not going to spend time talking to you about who I am or what I do. I think you can look that up. But when I was invited to talk, I actually wondered, what can I tell this brilliant room of researchers that you don't already know? And as I was digging through my toolbox, I actually asked myself a question: why did I say yes to this talk? And one of the things that kind of struck me is, okay, there is something I can bring to this table that potentially, hopefully, too many other people haven't talked about. So prior to entering science, I actually worked in brand marketing and corporate communications. And in that world of mine, I led lots of large-scale 360-degree marketing for some very renowned global brands. And in that world, if you did not connect with your audience in the first 6 seconds, which probably has now gone down to 3, thanks to the doom scrolling that we all do on Instagram and whatever else, you've already lost your audience. So emotions, purpose, and connection. It was not an option. It was an essential. And that mindset, fortunately, has never left me. And that's something that has stayed with me for longer than my research career. And that is something I've carried from the corporate world into the science communications world. So at the end of this talk, I'm not here to inspire you or whatever. I just want to give you a really simple tool that you can take back and you can apply in whichever communication settings that you're going to find yourself in. So let's begin with the first question. I often find myself asking this, and I think everyone should ask: why should someone even care about your research beyond obviously the citations and the journals and whatnot? And what I have observed in my short time working in this area, as I straddle through my research career and my clinical work, is there is a large disconnect. On the one hand, we have this academic world of journals and citations and impact factors and all the jargons we love to use. But on the other hand, we have the real world of people. The patients are actually living these conditions day to day. And as Charlotte really said, you know, if these are the people that don't feel heard, if they don't feel seen and felt and trusted, I mean, what's the point? We are doing all this work to serve the people. And if the people we're trying to serve don't understand why we are here, I mean, we can all go home, isn't it? Like, it's a waste of time. So this is where I guess, you know, sorry, I'm just trying to navigate my phone as I speak. And this is where the golden circle comes through. And I have to say, I'm terrible with slides. I hate PowerPoints, but I was asked to submit slides, so I have put something together. So this, I follow the rules in that way. So this is a golden circle. I don't know if many people have heard of the golden circle. And it talks about communicating inside out. It talks about starting with the why. And that's because when you communicate with the why, you're talking about your emotions, your relevance, and that is more likely to resonate with people. So as researchers, we always love to talk about the what we did and how we did it. So I could stand here and tell you that, oh, I'm actually co-designing a digital psychological intervention for people with chronic kidney disease. Is it accurate? Yes. Did it move any of you? Probably not, right? But what if I told you, I flipped it and I said, I'm here to help people with chronic illnesses feel less lonely and less psychologically distressed? So a simple flip of start with your audience, you can see how powerful that can be. And so this is what it talks about. And it's not just some marketing faff or, some really trick on Instagram or TikTok, but it's actually rooted in neuroscience. Because when we start with why, when we put the person, the emotion at the center, we're actually talking to the limbic system, the part of our brain that actually is responsible for emotions. It's responsible for motivation. And that part lights up when we tell a story, when we talk about values, when we talk about purpose. The other part of the brain, the what and your how, is the neocortex, the part of the brain that is responsible for reasoning, for analysis. However, it's important to note that the neocortex is actually primed by the signals that it gets from the limbic system. And that's why this is not just some faff trick, but it actually works because it's rooted in neuroscience. So here's what I want to leave you with quickly before Harpreet wants to throw me out, is start with the human, not the hypothesis. Start with your why. Your what and your how will fall in place. Don't worry about that. So next time you're writing a pitch for some ethics applications, to ask for money for people, policymakers to bring about a change, or a patient leaflet, or if you have the opportunity to deliver a talk, don't worry about the what and the how. Just ask yourself, why am I here? Take that pause, because if you're able to explain to people the why, everything that you say, the what and the how, they're going to automatically care about it. Thank you.
Thank you so much to Pooja, and it's so nice to hear people being at like the center of all of these talks. It's wonderful. Fabulous. Okay, so next up we have Ian Callaghan, who I'm very delighted to welcome to the stage, and Ian is from our Mental Health for All research programme.
Thanks very much, Lucie. How do I follow all of those fantastic presentations? I don't tell Fran, but I'm thinking of changing the topic of my research from lived experience leadership to imposter syndrome. It's lovely to be here, and I'd love to meet everybody at some point during the day. So if we've not met already, then I hope that we will do. So my name's Ian Callaghan. I'm one of the, as Lucy said, I'm one of the Mental Health Research for All Fellows, along with my colleagues. And I loved your expression, Lucie, research curious. This morning, I think I'm one of the research curious people here today. I'm sort of just billing this as, and I hope you don't find this too indulgent, I'm just billing this as my journey into research, really, and telling you a little bit about the research area, lived experience leadership, which is really close to my heart, because lived experience is something that's brought me to where I am now. Mental health research has helped me to thrive where I am now. It hasn't always been like that, and still have my ups and downs, and use my lived experience in my work. I've worked in healthcare. I had a healthcare career, if you like, quite a long time ago now, from university and shortly after university, but my lived experience of mental illness kind of interrupted things quite a lot. I worked in medical writing for the last 15 years, which is what has brought me ultimately here today. It's been in lived experience involvement and co-production. So as well as being the Mental Health for All research fellow, my day job is I work for the mental health charity Rethink Mental Illness. I'm a so-called lived experience program manager. We work with lots of different commissioners or involvement in co-production programs. That I have to say that the two keynote speeches this morning just sort of like everything that I'm learning on the Mental Health for All research program, is it just sort of expanding my mind. I don't want to say blowing my mind, so that has connotations, but expanding my mind, and all of the you know, the creativity that we've heard about, the fun aspect of research is what I aspire to be honest. So I piqued my interest about 10 years ago. Started a master's, but my work interfered with second year of that. So I got a postgraduate certificate in recovery and social inclusion. That was the first time that I'd actually started reading this thing called literature that people talk about. But subsequently in my work, I've sort of stepped into researching that we support some PPIE in various research programs. I've just had we've just published a protocol for a realist review looking at collaboration in risk assessment in secure mental health services. Very, very niche, but that's the first time that I've actually seen my name on a list of authors, which was really really exciting, and that has increased my passion as well. So our health and our health system, this is a sort of quote that kind of summarises really why I am so passionate about lived experience leadership, that our health and our health system both need the voice of lived experience to ensure we achieve the best possible outcomes. And so what is it and why is it important? Leadership at every level interests me, but I think I'm going to have to somehow narrow it down ultimately when come to developing a research question. It's things like, you know, what are our assets? How can they best be developed? And just Dr. Thompson's research presentation, the first thing, you know, about impact. How can we have maximum impact to achieve the best outcomes? I'm particularly interested in how it's almost sort of not self-selected kind of cohort of people, but there are lots of voices missing in lived experience leadership, and why, you know, how do we include more diverse range of people that are underserved in mental health systems, in sharing their lived experience, seldom heard groups, what underlies those inequalities hopefully will find its way into an ultimate research question at the end of the Mental Health for All year, when I come to actually start and actually do some research of my own. So thank you very much. Oops. Sorry.
Brilliant, thank you. Amazing, thank you so much, Ian. Fabulous. Okay, and so for our seventh and final speaker, we have Stephan Bahooshy. So Stephan is a commissioner in the local government in Camden, and he's also a social care fellow. So welcome, Stephan.
Thank you. It's great to be here. I feel like I've got the most difficult slot now after all those presentations. But yeah, so this is me. I work in Camden Council as a commissioner, so I design services for residents who access home care. And I'm also doing this internship through NIHR. So it's 2 days a week for 9 months. And actually Claudio over there is my supervisor. I applied, and then you get this opportunity to select or be matched with someone, and I chose Claudio, and then my research area is on LGBT people in central London and how they might experience or barriers of access to home care services. So ideally then to inform my work, but also other commissioners and service designers in London where people experience multicultural situations. My talk today isn't on my research though. I'm talking more about the process and my experience, and some of the positives that I think. So some reflections from me. So in terms of, I just think it's been so helpful in having that link between research and practice. So I'm mainly working in practice as a commissioner, and to be at this other side, you can see how it links together. In a different way. Obviously you hear about academia for me from local authority side, but yeah, it's just interesting to see how things work in academia, interesting, and I suppose for people in this room, how things would seem in local authorities or whatever areas that you work with. And yeah, just to understand that continual cycle, that link between the two. I found it really interesting seeing how different organizations function as well. I'm quite interested in bureaucracies generally. And yeah, it's interesting because you feel when you're in a system yourself, you get frustrated and you think, oh, this is happening, this isn't happening. And then you go into other situations and you realize actually everyone's experiencing the same thing. But that just helps you in terms of when you're doing research or if I was in practice, you know, it helps you think about where do I need to go to get this answer? Where do I need to who do I need to speak to? Definitely increased networks, which has been really exciting. But for things like future projects, what if I get the opportunity to do anything coming up in the future, then I've got these key contacts for then. So that's really helpful. It was really good to also have the protected time. So that's something in local government, at least, we don't often have for this kind of learning. So I really have that time to, already, gosh, time to go through and really think about a specific topic, which was LGBT residents and carers. Which of course is something that we should be thinking about in local government. We know that it's an area that we, in terms of underserved communities, we need to get better at doing, which then that links with improved knowledge on a specific area. Oh wow, this is, I'm rethinking the idea of having myself on the big screen, but never mind. This is me and Shabnam Ahmed. We both went to Salzburg 3 weeks ago. We were presenting at the European Conference on Social Work Education together. We started our doctoral journey together, and we're now both in our write-up year. And we did a co-presentation where we combined one of our themes. So I'm sharing this because even though I would have gone to this anyway, we applied in September, and that was before the internship. But I feel that as doing this process, being part of a different kind of culture, a different community, and being able to talk about a different area of my experience, I was far more present at the conference. I just felt more able to be there and to communicate and to do the presentation. Yeah, so I was able to be more relaxed, just have more fun, and be more confident in my presentation. But also one of the things I said to Shavs was, I've been asked to do this talk next week and it's with all these people. What do you think about it? I'm not sure. She just said, Stephen, of course you can do it. We presented twice together at this conference and at another one in Munich. So yeah, go for it. So yeah, thank you.
Yeah, take a seat.
Oh, sorry, yeah.
Yeah, no, that's fine. Great. Oh, so nice to hear about fun in research as well. Yeah. Right, wonderful. Okay, so thank you so much, Stephen. And I just want to thank all of our speakers again for so generously and creatively sharing all of your ideas and experience. So can we give all of our speakers a round of applause? And then welcome them all back up to the stage for the questions. Super. Oh, I need to move a chair for this. Got it? Okay, so we'll just rearrange this so that all of the people on Zoom are going to be able to see you all as well. Fab. Maybe that works. So, this is also part of a career in research, moving furniture around. Yeah. Fabulous. Thank you all so much. So we've got about half an hour for questions, and also if you want to expand on any of the points. 5 minutes is not a very long time, is it? Especially when you've got someone waving at you from the background. So I think Margaret and I were doing it accidentally, so sorry for like a different. Oh, all right, okay. Okay. Yeah, event organisation is hard work. So So fab. So can I open it up to so Jason, if you give us a shout if we've got any online questions, and then can I open it up to the room? Oh, sorry, missed that. Did someone have their hand up over there? Thank you.
Question. And I was just wondering if you were to kind of summarize in a few words, perhaps the key principles or the key values that are important for you when being involved in co-produced research, what would that be? All those people.
Is that a question to the whole panel?
Yeah.
Yeah, lovely. Ian, yes.
I think for me, what I've learned, and it was touched on in one of the keynote presentations, is listening to what people have to say and really actively listening to what people have to say and valuing people's lived experience in all forms. And it's the unexpected as well as the expected as well. So I think the flexibility, that relational aspect of interacting with other human beings in an activity is with the shared, arriving at a shared aim as well and shared goals. So I think we talk about in co-production, we talk a lot about sort of sharing power, but what does that mean? And often it's just people being together and respecting and listening and being present relationally together. So I think that for me it starts even with those very fundamental principles.
Oh, sorry, we've got several. Yeah, sure. Would you like to go first?
I was going to say clear communication, so making sure that the people with autism really understand what they have to be doing, make sure they really keep them involved at every stage. So you do the beginning and the end, you have to throughout the whole thing as well. And just having that respect and mixing
I'd say probably the most important thing is the purpose. And just the meaning of why we're doing something. And I guess once you nail that, to be honest, I kind of somewhat disagree with the fact that it's not possible to measure. Everything can be measured. If you have a really clear purpose on why you're doing something, because that will tell you very simply what you need to track. So I guess, and that is probably the difficult part to get to the why. But if you do have a very clear purpose in mind, what is your reason for being? Why are you here? Why are you involving all the other people, whether they're patients, people who have experiences, our policy members? I think it all comes down to that. And the reason why we face all these barriers and roadblocks is because we haven't been able to convince someone about the why. So I guess if you want to stop thinking about, reason for being, because everything will fall in one of the spirit.
Stephen?
Yeah, I suppose mine follows on from what we said actually, because for me it's also about allowing people who are part of services or research to inform research. But I think that also makes it relevant. So think about saying that why makes it more relevant. You're then going to do something that people actually want to be done rather than something that you do yourself. On my PhD journey, I set up a reference with informal carers. And one of the things I remember from that was that when I was explaining to them the whole journey, because I did it part-time, long, I think one of the things I was telling them was that was how long it was. And one of them said to me, "Oh, don't worry, Stephen, we'll get you through this." And I just thought that was this small, but that was because we know it's a lengthy journey. So yeah, I just thought that was really necessary.
Yeah, I think that really echoes Zach's point about we're all learning together. Yeah. Sandev, did you have something to say on this question?
So I think as well, echoing what everyone else said, I think don't be afraid to be creative. And I think when we say creative, it's not just about thinking, oh, let's do an arts and crafts activity. What I'm thinking about is actually, what does that creativity mean? And sometimes we get bound by the institutions that we work in. Sometimes we get afraid to work with another set of frameworks, a set of boundaries, and actually we say, can we really push them? Whereas I say, if you're researchers, you're there to push those boundaries, like that is almost your purpose and your job and your why in a way. So actually don't be afraid to push those and think, what is it that that community that I working with needs? What have they done? What works for them? And if that's some content for me, then part of that is me also learning on that journey with them. So actually, if it's something I'm familiar with and I'm doing it as part of a research project or something to do, with research with that person, I'm still doing it to them because it's what I'm comfortable with. Make sure it's about open communication and thinking about, just because something's a tradition doesn't make it right. And sometimes our traditional approaches are, embedded in our work because we've learned that from our supervisors, we've learned it from their supervisors, we've learned it from a research context, but actually research is becoming more than a published paper. It's becoming engagement with the people and the community we serve. So, we're increasingly in a society where small bite-sized information is really useful. I don't know if anyone remembers BBC Bite-Size years ago. That's how I used to revise. I used to get the little bits of like the BBC Bite-Size. That comes into play with social media, with Instagram, TikTok. Putting that, you will find things out there in that way, and just almost like stating those quick wins of how we can implement it and make it happen is really, really powerful. Obviously, some things take much longer, but what's that nugget of information that you've got that's really powerful that can be affected almost immediately.
I was going to quickly add something that's very
Please.
because it's linked to what you guys said. I think it's lost about also because it's not an easy thing to do. I've learned it by doing it in practice that it's not always easy. So it's lots about, I feel, negotiation and being realistic about what you can do within a project. Because obviously you're doing something for the community, in this case for my community, and people come with certain goals, something that they want out of that project, something that's really tangible and that makes a change. But sometimes within the funding that you get, you can't do everything. So it's lots about being open, about having those difficult conversations even, and really negotiate and be realistic about what you can do.
Thank you. Thank you so much for all the fun. Oh, we've got loads of hands. Fabulous. Yeah, thank you. I'm just want to check in with the people. Can everyone hear okay? Do we need to switch? Yeah. Okay. Fab. We don't need to introduce any more technology. Thank you so much. I will come to both of you shortly, but we're just going to take a question from Zoom that Jason's going to read out at the back.
Yeah, so we've got a question from Jade, I think it's NIHR fellows. They're asking, what would you say has been more helpful to follow your passion research or your curiosity? So is it about passion or curiosity research?
Great question. Wow. Was that directed at anyone in particular,
No,
Jason, or no to the panel? Great.
I say, well, something like that, yeah. Like post that's ugly fair, yeah, asking about afterwards, isn't it?
Yeah.
I'd say it's the commitment. Commitment to change, to make something better. That probably encompasses your curiosity, your passion. If you're committed to something, I'm having.
We could find another people with that same passion as well, and that same curiosity, because we end up kind of driving each other on. You know what I mean? Like if you're in a nice environment, I'm that. When I first got involved in mental health stuff, I'd come on first psychiatric unit, maybe 6 months previous. But I've gone from like my first sort of stint with mental health issues, psychosis, medication, and all that kind of stuff. And started getting involved in mental health BPI work. And I just found like people are a lot more supportive and just helping understand the issue in a different way. Like come at it not necessarily from a clinical angle, but having that kind of support from like people like Manchester City and Greater Manchester health groups, like bringing me forward quite a lot.
I also think it's probably a balance of both, and I think you can get so passionate about a particular thing that you almost get so lost in it, and that objectivity kind of comes away. So I'd say be passionate about the research area rather than the specific bit, but be curious about everything. And I think taking that approach means that if you surround yourself with other super passionate people, it doesn't become something like group thing where everybody thinks actually this is the answer I want, but actually you have a generic question, sorry, a question that is specific to a, an area that you're interested in, but it doesn't lead it in a particular direction. And I think if you're super, super passionate, you might, unconsciously want it to go a specific way, and that route might feed into that. So I'd say passion in a measured way, as hard as it is, and I know it's really hard, but keeping that objectivity as best as you can, and so it's not something you can always do.
And so for me, I'm gonna literally say the opposite of what I'm saying. So my first question that I'm holistic lifestyle, holistic lifestyle, like help women so I meeting a lot of people around me. And then the question that I now like want to be a passion, because I was working in the charity, I was seeing how much support was helping people in the charity, and then I was seeing lack of funding for this to like carry on and be long term. And I thought, how could I help make a positive impact? And that passion to want to make the impact is what made me choose when that question is going to be so passion for me is going to be that.
It's been the thing to follow. Yeah.
Yeah, thank you. For me, I think passion has come first. And I think what I'm discovering through the mental health fellowship is how to be purposefully curious. So I think, I have a lot of curiosity, passion is pure curiosity, but it's about being curious in a purposeful way, in a sort of a practical way, and learning to do creatively as well. But then it's more important to have passion first, and then curiosity, and to develop that curiosity in a way which achieves the aims that you've set. Jonathan. Thank you.
Lucie, I think you had your hand up, and then we'll come to you, Hogger.
Kind of a question for anyone in the panel, but so I'm interested in rare disease. There's a very small population of people. You're obviously applying for different funding streams, you're trying to get funding for your research. How is it best to keep momentum up with that small group of participants or PPI that you want to get involved in your research, when you're kind of waiting for, there might be like a 6 month year break between your funding or in those early stages of your career? How do you keep that momentum up with people sharing wisdom?
Talk about often when you go.
Yeah.
Like, I've had this quite a few times over the years where you'll chat to someone academic prescriber and you've got an idea for a project, well, do you want to get involved in it?
Yeah.
And then I'll get involved in that, and you're not hearing anything for like 6, 7 months, and all of a sudden, you still want to be involved in it.
Yeah.
It's a bit of a strange one. So like, just figuring out the blue.
For me, I would say just being honest with them about what the timeframes are. When I met with my reference group, it was usually for 3 months or so, sometimes in 6 months, because it is such a long journey. But just being really clear to say this is what the timeframes are, so they don't forget and I'm not going to cover them like you're descending when you're likely to again.
I think it kind of links back to the thing that was made before about passion, in the sense that I've been doing LGBTQ plus interaction for 5 years, and I never ever got any like major funding to do it. Still, I think if you're really passionate about it, there's ways in which you can work it out. There are some activities that do not need substantial funding, if any. Actually, if you want to do a couple of workshops to develop ideas, you don't need that large amount of money. So I'd say there's still activities that can keep you in contact with your community throughout the process of waiting for the big thing to come. And the second thing I wanted to mention is there's also like small pods that you can apply for. These are usually quicker rounds, and sometimes not even what are they called, when there's no like fixed deadline. You can apply at any time. Do you know what I mean? So in my experience, the small funnel is actually something that granted you that small amount of knowledge to meaningful stuff as opposed to waiting for the big thing that never came actually so far. Yeah.
Things also interesting to say. I'm using some, I think, because you can get a flux, be that have different flux, be creative ones.
And perhaps Charlotte and Zach, I could ask you, what would help to build trust in those long periods between emails when you don't hear for 6 months? What would be helpful?
Even this like is really taken like every month.
Just checking in.
Yeah.
Another thing we try and do, because we have an involvement community that we call an involvement community of people who might be interested in different sort of projects, and it's signposting people to other things as well in the meantime. So for us to be aware of what else is going on, well, that might be something that interests that person or that group of people sort of in the meantime while we are waiting, because we often have that problem between the sort of co-production element of the research proposals to actually getting the funding and then performing the whatever the writing is going to be like. There's quite a long time in between, and just definitely staying in touch. You know, the occasional email with the resource that you have, but also signposting to other opportunities.
Thank you. We had a question from this side of the room.
Hi, I'm Howarth, I work with Medical Council, and just to say, Claudio, you mentioned quality over quantity. And I think working in local authority where we're focused on impact, you know, and yes, you want to do research that also stands the test of papers, right? And so the question would be, and sometimes how much is the minimum quantity in terms of, you know, you're doing a quantitative study and you know, you get 50 persons and you send it to a journal. It makes an impact in your community, but it's not something that can go into a paper and then yes, you're having impact in the local community, but it doesn't get published because it doesn't seem to test the rigors of quantity. And so how do we get that balance between quality versus quantity in terms of numbers? And
that's a great question. And it's something that just struggle with time with. You got a small sample, you don't get published, papers just reject your article because it's not enough. I think for me personally, if you present outputs, whichever they are, that kind of represents in some respects the diversity within a community, that is sufficient enough to warrant I don't want to talk about publication because I don't think it's necessarily the way to go to disseminate. I mean, we've seen this morning how many in a much more impactful way there are out there. But I'd say, for example, in my LGBTQ+ with the storyboards, we aim to and we're able to represent all different communities, sub-communities within the umbrella LGBTQ+. And actually, my argument is that it's much more powerful sometimes and impactful to go in depth with a single story in terms of its narrative than with a large number of faceless data, if that makes sense.
It might be various research designs are meant to serve different questions. So I'm not entirely sure if there is a balance between a qualitative or a quantitative, because the whole idea of qualitative is not the power game. It's, you know, when you want to test a hypothesis in a large group of people, who's like use that one design and you have the power and you have all the theory behind it. But if you're interested in really zooming in and knowing something that you won't get from your quantitative, I mean, you're very welcome to do case studies, which are really a few cases actually. So it's really about what are you trying to understand and not feeling pressure with the fact that, I mean, 50 for a qualitative interview is fabulous. Where did you get those people from? Because it's quite difficult to get that kind of sample size support. So I think not being pressured by the methods again, and just going back to, you know, what is it that we really want to find out? And what is the most suitable method to get to that outcome?
Just gonna say, when you're sharing the information, I think it's good to remind the audience the impact of qualitative research, and that it is linking in with what Claudio said, with sort of deeper analysis of what's going on in the community, but also the fact that, you know, if you're researching into minorities, then by definition you're not going to have a big sample or a significant sample based on white British people. So, but it's by doing qualitative research that we have begun to understand the impacts that they experience in life. And without it, people who really know, we wouldn't be talking about it in the way we are.
Okay, next question. Two questions. Like the main one is this is really especially for the speakers to work with the government or institutions. It's really easy to apply equality, diversity, and inclusion when you research, or it's very complicated. And the other thing, my other question is, what about emotional intelligence when you don't understand? It's really easy to apply emotional intelligence. I think that passion and curiosity can relate to emotional intelligence. That gaining that skill is also part of the research. So, any question that you would like to answer?
Should we take your second question first about developing emotional intelligence as a research skill? Yes.
Maybe start. I think it's really important, and there have been times it's really good to be able to read your participants when you're speaking to them, and to move away from this extractiveness of research. There have been a few times when I've done interviews or when I've done workshops or something with people, when talking to people, I've noticed that it's just too much for them. They would be too stressed or whatever. And I've said to them, you've got too much on, don't worry about it, that kind of thing. So really having that involvement and understanding and empathy, but it's on how they are and being able to support them when they are in those experiences.
Yeah,
Thank you very much. For me as well, emotional intelligence about learning as well as being in trauma informed practice as well. To do with treatment such as staying in reading, being able to read how people are feeling and what people are saying, what's coming up from people, and particularly in the world we have moved to, particularly after the pandemic, moved to doing online engagements. And I think we need another emotional intelligence language there as well, to be able to judge how people are feeling and what impact you're having, and want to be trauma informed in that space as well is very complex. But yeah, I think it's extremely important and something which I'm still learning how to do more often.
That's a really good point. I also think people need to know about you. So the people you're working with, not about what you do, but you as a person. And I think sometimes when we go into environments and we say, we're going to be asking you questions, we're going to be engaging in research, it can almost feel as if though it immediately puts that power imbalance in. So actually by disclosing stuff about you, like your hobbies, like things you did, what you made, and those types of normal things you would have in a boundaried way with the people you're working with, can really go a long way in helping them to feel much more relaxed and actually say, oh, this is a person conversation. Yeah, and I found that's worked quite a lot. Even as small as like offering someone a cup of tea and just asking, how's your day been? That can be a real icebreaker, just to be like, that is a situation I'm comfortable in now. Actually, it means that we've had a small exchange of information. You've done it in your boundaried way, they've done it in their boundaried way, and that creates that safer space. I never like to use that word safe space because we all need to define that. We can use that in many different spaces, and people do, but we're making it safer for that person, but also safer for us to learn from them. So that's where that emotional intelligence comes in, is that we are confident with the fact that we don't know as much as we should know about each other, and let's get to a middle ground so we can make that happen.
Please.
I think it's so that when I was with people, I went back to check out the reading that you want to run. Some of the funk readers, some that like some people are way further places. You know, but it's good to check in, check out. You get good minds of like how they found the conversation and the activities. Yeah. We're always learning and growing.
Absolutely, yeah, remaining flexible with you always learning that. I'm just going to check in and see if there's nothing burning from Zoom. Okay, are there any other questions from the room? Okay, I think I'll just ask us to join hands and thank our presenters once again. Thank you so much. I really enjoyed hearing about all the different types of knowledge being valued and the different ways of being and the different ways of being a researcher. And I really love the diversity. So thank you all so much. I hope you all can now enjoy a lovely lunch. So thanks to our slight technical hitch earlier, we're running 10 minutes behind. So the workshops were due to start at 1:30, but they'll start at 1:40, so you'll get a break. And just say, oh right, okay, we have to start at 1:30. All right, okay, so that's Fran's workshop. Yeah. Okay, so if you're going to the networking workshop, your first out the door, please go avail yourself of the food. And everybody else we can join at 1:40. Lovely. Is that right?